Diabetes UK brings its roadshow to Norwich in order to help local people find out their potential risks of developing type 2 diabetes. Lawrence Baker, the manager of Diabetes UK, explained that why they held the roadshow for public.
Diabetes is a real growing issue in the UK for lots of different reasons, but one of the issues with type 2 diabetes is the symptoms come on very slowly and they're quite subtle, and it means lots of people live with the condition for a long time before they get diagnosed. So we're here today speaking to members of the public and encouraging the people who need to go and see their doctor to talk about their risk of diabetes.
David Waters, who is a patient of type 2 diabetes, sharing his feeling about this disease.
I'm a type 2 diabetic patient, so I was diagnosed as having type 2 diabetes just over 2 years ago. It is a very serious illness. It doesn't have apparent signs other than normal sort of tiredness and wanting to go to the toilet a lot, but it has very serious implications if not controlled earlier in life. When you get into your later years, it can be very serious as regards potential loss of your sight, your feet, and other issues regarding heart and stroke.
So how can we evaluate the risk of getting type 2 diabetes?
We ask you a series of questions. Each question has a score associated with the answer. We add up the scores, and then from the total we work out what your risk is, whether it's low, increased, moderate or high.
As the study shows, Black African and Asian people have the high risk of getting type 2 diabetes. Apart from that, their family members also worry about it.
My grandma passed away because diabetes, and my father also gets this disease. Now my father taking insulin every day, and he needs to control having sugar, even having rice.
We also know people who are from South Asian or black ethnic background can be up to 6 times more likely to develop the condition. Because we know there is a strong genetic link with the condition, there's lots of different treatments. Sometimes at a point of diagnosis it might just be making lifestyle changes, so diet and perhaps a little more exercise or being more active. However, there's also tablets and there's different treatments like that, and sometimes straight away but often later on with the condition it can include eventually going on to insulin as a medication, but there are lots of other treatments along the way.
Here is Lin Yuechen's report.